अस्सलाम गाइस। तो अब हम स्टार्ट करने लगे हैं द रीनल सिस्टम। आई विल ट्राई माई बेस्ट कि मैं जीआईटी और गॉल ब्लैडर वगैरह भी इसके साथ करा दूँ, क्योंकि ये थोड़े से रिलेटेड टॉपिक्स हैं। सबसे पहले हम बात कर लेते हैं कि डायबिटिक का पेशेंट आया है और okay, so there is a patient with diabetes, right? And he has presented with the following symptoms. Just a sec, I'm trying to basically find the laser that ये इसमें है. I don't think इसमें है. चलो. So there is a patient that is presented and he has decreased urine output. There is dyspnea and also pallor. And then the lab results, as you can see, the urea is very, very, very high. The creatinine, the hemoglobin level is and the creatinine level is also high, and the hemoglobin is also high in the urine. So what is the diagnosis? The diagnosis is diabetic nephropathy, because there is a renal damage due to the long history of diabetes. And the early marker for the acute injury, this is very, very important, is neutrophil gelatinase associated lipocalin. Remember this and put it in your memory that it is NGAL, neutrophil gelatinase associated lipocalin, right? NGAL. What is NGAL? NGAL is neutrophil gelatinase associated lipocalin, and it is a very active marker of acute kidney injury. And you can also use like creatinine levels, but NGAL is a very good and specific marker, which is neutrophil gelatinase associated lipocalin. Next, we have a male that has diarrhea and urea. The pH level is somewhat normal. Carbon dioxide is very low. It can indicate acidosis. उसके अलावा bicarbonate levels are also very low. That can be metabolic acidosis, I think. Okay, and then the serum sodium, the urea level is very high. Kidneys are not white, and the serum sodium is normal and potassium is not normal, but it is increased. So there is hyperkalemia. So what is happening in this case is that hyperkalemia is usually a sign of pre-renal failure, right? So it's like a sort of कह सकते हैं कि तरीका याद करने कि हाइपरकैलेमिया जहाँ आता है प्री रीनल फेलियर. क्यों? क्योंकि बेसिकली डिहाइड्रेशन है, जिसकी वजह से रीनल फ्लो कम है, और जितना रीनल फ्लो कम है उसकी वजह से चीज़ें एक्सक्रीट जो हैं वो नहीं हो पा रही और वो ब्लड में आ रही हैं, जिस तरह के सोडियम हो गया और पोटेशियम हो गया, ठीक है. तो इट कैन लीड टू acute tubular necrosis if not managed properly. Next, we have very favorite questions of UHS, which are the slide based questions. they are asked very commonly. So we have renal cell carcinoma. इसको ड्रॉस में भी पूछ सकते हैं. उसके बाद उसने पूछा है क्लासिफिकेशन. इसकी 3-4 क्लासिफिकेशन होती हैं. इसको मैं जो वाइवा वाली वीडियो है उसको एक्सप्लेन उसमें भी करूँगी, ये इंपॉर्टेंट है. क्लियर सेल, पेपिलरी, ट्रोमोफोब एंड जिलेटिन डॉट, ठीक है. क्लियर सेल, पेपिलरी, ट्रोमोफोब एंड जिलेटिन डॉट. ओके. Clear cell, papillary, thromophobe and gelatin dot. Okay, moving on. Again, you have to remember this is the clear cell, papillary, this is the thromophobe, and then we have gelatin dot. Gelatin dot is not that important, that's why uski diagram nahi de di, but you have to remember clear cell, thromophobe, gelatin dot, clear cell, papillary, thromophobe and gelatin dot. Here again, this is clear cell, this is papillary, this is germophobe, and then we have the gelatin dot. This is the gross of the renal cell carcinoma. You can see the yellow neoplasm. Okay, this is again a diagram of clear cell. Okay, this is well defined margins. They are vacuolated. The reason why it's called clear cell is because vacuolated cells are there due to the presence of lipids and glycogen. तो वो stain ऐसा होता है जैसे clear सा stain आपको आता है इस तरह से. It's not eosinophilic, right? The nuclear small round blue tumor cells. They have delicate branching vasculature. They are solid as well as cystic areas. Basically, the morphology is very easy. You can explain if you know the diagram, if you know how it looks like, right? So again, we have the male, he's presenting with these specific symptoms. The urine and creatinine level are out of the charts, बहुत ज़्यादा ही हैं, ठीक है? That is a clear sign of diabetic retinopathy, renal damage, and the marker is NGAL, which is neutrophil gelatinase associated lipogenin. Neutrophil gelatinase associated lipogenin. Lipogenin is also can be used. The creatinine level can also be used. Next up we have chronic kidney disease. Why? Because this is a person who is urine urea levels are in somewhat कह सकते हैं कि decreased creatinine levels and protein is very high. So जब protein urea होता है, that is usually in chronic kidney diseases, and the common causes of these results are diabetes, hypertension, PPH and pyelonephritis. Basically इस patient के case में जो चीज़ ज़्यादा specific हो, because this is a male, so that can be BPH, that can also be chronic pyelonephritis, that can also be diabetes and hypertension, which is very common in Pakistan. The acid weight disorder that's not very commonly present is metabolic acidosis, जो कि diabetes में होता है, as you have seen in this one over here, जिसमें हमने acute tubular injury की बात की थी, this one, right? So as you can see, there was acidosis and there was metabolic acidosis, right? So that is a pathognomonic of diabetes mellitus. Moving on, we have this tumor. This is a Wilms tumor. This is a basically tumor. इट्स टर्म कहते हैं क्लियर रीनल सेल कार्सिनोमा, और इसकी जो मेलिग्नेंट सॉर्ट ऑफ बच्चों में होगा वो विल्म्स ट्यूमर होगा. एंड दिस इज वेरिएटेड अपीयरेंस. अगेन देयर आर येलो एरियाज ऑफ हेमोरेज नेक्रोसिस. वेरिएटेड जब मतलब ही यही होता है कि देयर आर डिफरेंट टाइप्स ऑफ एरियाज. सम आर गोइंग टू बी येलो, सम आर गोइंग टू बी नेक्रोटेड, सम आर गोइंग टू बी bloody in appearance. This is again a Wilms tumor that is in the lower lobe of the kidney with a characteristic tan to grey color and a very well circumscribed margin. This is how Wilms tumor looks like in the microscopy. There are tightly packed tumor cells. Why? Because they are from the blasternal complex.